Welcome back to Healthcare Systems. In part two, we discuss healthcare systems in Ontario. As I noted in part one, when we talked about healthcare systems in Canada, societies use theories of distributive justice to try to ensure a fair distribution of goods and services. In Canada, it is the provincial government's job to formulate and enforce policies for the distribution of scarce resources, and there is no easy solution about how to split the pie, for example, the available resources. Even before COVID 19, we had already been living in a society of deficits. For example, the deficit in Canada pre pandemic was greater than 20 billion. In Ontario, our deficit was greater than 10 billion. Both deficits are much higher now, which raises questions about how these deficits will be reduced, as well as who will pay for these huge deficits. When most of the healthcare dollars go into acute care, as is expected under the Canada Health Act, then other health programs such as public health and health promotion inevitably suffer, even though these programs could have an enormous impact if they prevented illness and disease, as we are seeing during the pandemic. Pre-pandemic, the Ontario government proposed consolidating the province's 35 public health units into 10 regional agencies by 2021 and reducing the cost sharing between the province and municipalities. This type of change is supposed to reduce costs and free up money for other resources as well as reduce the deficit. I wonder what will happen moving forward given our COVID-19 experience. Different governmental parties play a large role in the healthcare policies within a province, as they each have their own views on what is good for society. For example, the Liberals tend to focus on societal safety nets, whereas the Conservatives often want to reduce such safety nets and place more emphasis on individual accountability. This COVID-19 pandemic has seen quite the change in Ontario with regard to the governing PC party, though, and I for one am grateful, as otherwise I think we would have been in trouble. Maybe in the same trouble that they faced in the US, with people arguing over face mask use because they didn't see the positive effect from a community or societal view. Rather, they focused on their individual rights, as they called them. So I've asked you to look or review, in our required preparation for this week is the Healthcare Force Ontario videos. The part one video from Health Force Ontario will give you an excellent overview of the Canadian healthcare system, whereas part two focuses more on care within provinces. You should have a strong understanding of what is in these two videos, and we will also be discussing some of these topics in other weeks of this course, such as Canadian nursing organizations and both intra and interprofessional collaboration. When the PC government won their super majority in June 2018 with 76 of the 124 seats and 40.5% of the vote, they could force through legislation because of their majority. They immediately started making changes, not just to healthcare, many of which they had to walk back quickly because they weren't feasible for various reasons. But one of the things that they want to do in healthcare is to improve the system so that it is integrated and people can move smoothly between home and hospital as needed, access a team of healthcare providers to meet their needs, and have a medical record that they and their providers can access easily. I agree with all of these goals, and I hope they will be implemented in a careful, thoughtful way so the best parts of each goal become successful and any potential problems within the goals are eliminated. The overall goals of improving the system are to provide excellent care regardless of setting and to save money while doing so. In their article, Wheatley and colleagues showed how nurses can help transform a system, and I believe that nurses can be an amazing force for transformative change in multiple areas of the healthcare system, given our skills and leadership abilities. Perhaps you are thinking about transforming the system while saving money is an impossible goal, but you will find some other good ideas about what could be done when you read the article by Martin and colleagues. As you move forward as an RN, you can expect one thing for sure from the healthcare system. It is always changing. So you need to be ready to change with it, as well as change it. In Ontario, the move is toward Ontario Health Teams to provide a breadth of care, so perhaps you will find yourself working in a way that you hadn't thought about before. In addition, existing provincial health agencies and specialized provincial programs such as Cancer Ontario are being amalgamated into a single central agency called Ontario Health. This will oversee the entire healthcare system. There are pros and cons to this move, as there have been both successes and failures when similar centralization has occurred, both in Canada and other countries. You will be entering the nursing profession in Ontario as the province undergoes significant reform, so you need to pay attention to what is happening and be prepared to reevaluate your career planning if need be. I'm an optimist and I hope that things will get better and we can have an even better healthcare system in Ontario. So next up, we're going to be looking at healthcare systems in other countries.